Chair, and thank you very much to our witnesses from Canada Life from being here today. I'll open by saying the same thing I said to your governmental counterparts, that as you've indicated, this is a serious issue that has had a significant impact on public servants, those who have served Canada, and their families. And I wanted to provide a couple more stories that we have seen in the media testifying the difficult time that these families have been through. The first one is from Sabrina Hoke. Aidan Clark III was diagnosed with global developmental delay when he was 3 months old. He receives weekly speech therapy, occupational therapy, and physiotherapy. With a $1,500 cap on physiotherapy, his parents aren't sure they'll be able to provide him the care he needs. I'm determined I'm not going to change his plan, his mother told the CBC. It's a stress and it's very frustrating. She spends about $400 per month for the regular physiotherapy, plus another $1,650 for intensive physiotherapy every 4 months. So far, knock on wood, within 3 years, there's been no regression, and that's been because we've kept a steady pace. We've been very determined. We've been on the ball with making sure that he gets weekly physiotherapy sessions. But she said the physiotherapy cap has had a dramatic effect on the family's lives. We're left hung to dry, she said. We're hitting a wall already with a non-existent customer service. When we push through that wall, we connect to someone to be hit with another wall where there's no exception for families who are dealing with lifelong challenges. This one is from Allison Abraham. She has not been able to submit her medication for Crohn's disease through Canada Life, and she worries the drug company will stop paying for it because she's supposed to have medical insurance. When the government switched to Canada Life, we are promised seamless transfer of insurance. It has been nothing but a pain, though. One of my life-saving drugs is about $20,000 per injection, which I get every 8 weeks. Without this drug, I would be bedridden and dying. Unfortunately, since the insurance switch, I do not have coverage. I spent countless hours calling to make sure my coverage is active, but still can't process anything via their website or the pharmacy. Thankfully, they've offered me temporary relief in order to get my medication. It's infuriating I'm having to rely on a service that people who actually don't have coverage use because my insurance provider can't get it together. I fear every time I order my medication that this will be the last time that it's covered. So my first question for Canada Life, please, is did you have a discussion with the resource requirements, with the government prior to the July 1st implementation?
Thank you, Mr. Chair, and to the honourable member's question. Certainly, we've discussed in the previous testimony as well the 18-month startup period in which there was significant collaboration with the government to ensure that we were working through a lot of the deliverables and being ready for that July 1st date. Resource discussions were not a significant part of that discussion, although we had done our own estimates based off of many of the historical points of data that were provided within the request for proposal from the previous contractor. As noted several times, the complexity of the change and the quantity of changes that happened at the July 1st transition date did lead, unfortunately, to a number of calls and service issues that were unforeseeable. And it was the addition of all those changes together that created these unforeseeable challenges. Regardless of that, we acted quickly and in collaboration with the government to enact our customer service action plan. And to that, we have increased our call center agents and increased our claims examiners. Certainly, we know people are frustrated and the individual circumstances cited there do not meet the service standards that we would expect. But our customer service action plan has been working now, and we are being able to take calls within 1 to 3 minutes. And certainly we are committed to processing every eligible claim within the 2-day period that we have now.
Thank you. Is it the standard practice of Canada Life to require manual enrollment when switching between plan administrators?
Thank you, Mr. Chair, and to the honourable member's question. We understand that the government had the objective of completing a full re-enrollment in order to clean up a lot of the enrollment data and to make sure we had everyone eligible on the plan. We understand that was cited, of course, very publicly in the contract, and it was when we worked towards throughout that startup period. On the rest of our contracts, typically this is not a standard practice, but again, the plan of the PSHCP is very unique. And as cited by Treasury Board earlier in their testimony, the dispersion and the high number of people who are all across the country and some even posted abroad did necessitate a look at a manual re-enrollment process.
So then in your estimation, what was the overall impact on call times and claims processing because of the use of manual enrollment, please?
Thank you, Mr. Chair, and to the question. The initial re-enrollment and manual re-enrollment period was certainly the driver of a majority of calls in the early parts of the contract. There were some people who were not able to access their benefit at that time. And so we worked collaboratively with the government again to quickly enact the first part of our action plan, and that was to complete an accelerated enrollment to auto-enroll all remaining members. Once that was completed, call volumes dropped significantly, and it stopped becoming the significant and major issue that we were facing in our contact centers.
And for what period of time would you say that this was a significant percentile of your calls, the adjustment for the manual enrollment, please?
Very brief answer, please.
Thank you, Mr. Chair. For really most of the summer months, so the first 2 months of the contract, this was the majority issue, but it did begin to subside from there